Good evening, everyone. Thank you all so much for joining. We're going to get started now. We've got a good number that have joined. I think we had about 300 or so register for the session, which is fantastic. We've got about 100 just over joining. So we'll take that as a good sign that we can make a start. So yes, first and foremost, thank you so much for everyone joining this evening. We'll be recording the session to be able to share for anyone that's not able to join at either this session or the one we've got planned later in the month as well for reference. But before we kick things off, firstly, just to say, my name's Michael. I'm the operations manager here at Moatfield. Been heading up this project of revamping our appointment and access system. It's something that I've been very keen to essentially get in place for the last year and a half since joining Moatfield. So very, very excited that we're now finally at this point where we can share the news that we're starting it and share the new system with all our patients as well. In the Teams call, I do have Emily, our IT and data lead. She'll be supporting from a tech side of things, just making sure everything runs smoothly. We don't have the chat function enabled for the meeting today, but there is the Q&A section. So hopefully you can see at the top of the little tab, there should be a little button that looks like some speech marks, and it has Q&A underneath there. We had a few questions submitted yesterday. But if you've got any questions throughout, just please pop your question into that Q&A section. Emily will try and respond to any questions as they come up, but we'll have some time at the end for some questions as well. So without further ado, we'll make a start. So what we're going to be going through this evening is we're going to start with actually a bit of a review of why we're moving away from the current system. I know the main thing is learning about what is the new system, how will it look, how will I make requests to the practice, but it's really important for us to understand the context of why we're actually changing before diving into what the new model looks like. So once we've done a bit of a review of why we're looking to move away from the old one, we will have a little bit of a dive into the new system to see what that looks like. And importantly, we'll be demonstrating how it will look like from the patient's perspective, so how it will look like to complete this form and how it will work for those that don't have access to any sort of digital tool, so whether they don't have access via their phone, laptop, or tablet and such, and we'll kind of touch on that as well, which is obviously a really important part of this. And then we'll also just give some details on the timeframes when we're looking to go live with the new system and what support will be available when we do switch over. So let's get started then with a bit of a review of why are we actually moving away from the current system. So to start with, it's understanding what the kind of traditional model of general practice accesses look like. And this starts with the patient's request. So when the person has a particular concern or issue that they'd like to raise to the practice, it comes through obviously through the telephone and front desk, and those requests are filtered through our patient services team. The patient services team are not clinical. Their job is not to figure out what the treatment is or how urgent the issue is, but their job is to identify which or what clinician is most appropriate to be dealing with that particular request. So obviously that encompasses booking them into a particular member of the practice team, but it may also be understanding where they can signpost that request elsewhere in the care system as well. So that's your kind of traditional model of access that has always kind of existed within general practice. This role within patient services to kind of ask what the issue is before triaging it has been a more recent addition to the previous model of kind of turning up and waiting for the appointment in the practice itself. But this is the model of access we've been operating from. And in terms of the appointment structure that we've got at the moment, essentially what happens is we have appointments that are added to the system 6 weeks ahead of time. That's how far ahead our clinics are added, and out of all those appointments that are added to the system, a select proportion of those are made available to be booked in ahead of time. So 6 weeks ahead of time, all the appointments get added. We make sure that a certain proportion are made available right away as they're added, and then also between that point of the clinics going on and appointments getting added to the particular day where the appointment will happen, we'll also have a lot of follow-up follow-up appointments that are booked in based on clinical requests. And then essentially at the end of all that, what we have is this resulting capacity of what's available on the day. Now, as we'll get to in a second, one of the issues we have is essentially, although we do add these pre-books onto the system 6 weeks ahead of time, because of demand, how it is and the way that the system works, as soon as those appointments are added to the system, they're essentially booked up pretty much instantaneously, which means from a patient's perspective, calling or coming into the practice, asking to book an appointment, the experience is actually, well, you're either trying to get an appointment for that same day, or if there is something, you're getting told that it's only 6 weeks ahead of time, if there is something free as well. So in theory, what we're trying to do is allow a proportion of the appointments to be pre-booked ahead of time, but because essentially the demand where it is at the moment, all of those tend to get booked out straight away, and we only really have this kind of 2 areas of either same day or the pre-book 6 weeks ahead of time, which is one of the core problems of the current system as it is. But nonetheless, that's the kind of background of the current appointment structure as it stands. Obviously, our capacity, the number of appointments we actually have, is going to be driven by a whole variety of factors, which revolves around the premises itself, how many consulting rooms we have, how many clinicians that we have at the practice, the different working hours of the different GPs and clinicians, the different responsibilities that each of those clinicians has, the type of appointments in terms of face-to-face or telephone, whether they're 10 minutes, 15 minutes, all those things will obviously impact our capacity as well. But if we turn our attention to kind of, yes, that's the structure of our current appointment book, but where do the problems come from? So for me, I'm a big visual person, so this gives a bit of a visual illustration. I'm going to talk you through what we're looking at here, hopefully to make sense of it. So what you'll see on your screen is you've got this lovely colourful arrange of squares. That's obviously representing all the different people that are coming into the practice each day. And we've got a lovely funnel indicating the fact that each day when the appointments go live, obviously people call through at 8 a.m. or as close to 8 o'clock as they can to try and schedule an appointment. And essentially what that's funneling into at the bottom there is the available appointments for that day. And what's important about this visual is you can see that essentially that funnel is just going into a singular day of clinic. Because the other appointments are protected and can't be booked into for the coming days or coming weeks, essentially everything coming in that particular day is going to get funneled into what's available on that day. And this model has so many issues with it, and I think it's important for us to be open and honest about that because it's the very reason why we're changing it. The first thing is the fact that we get this massive bottleneck around 8 o'clock when the appointments are released. So that obviously gives us this overwhelming surge in calls coming through that needs to be managed, but it's also incredibly difficult for those people who have commitments or difficulties calling through at 8 to actually get an appointment. There's also the point I've touched on previously, which is when you do come through, you get essentially this limited appointment issue where you either have something that's available that day or an appointment that day or something that's 6 weeks ahead, which isn't on this visual, but if we were to have it up to 6 weeks in advance, you'll see a proportion that are available to be booked ahead of time. And a lot of people are left with a sense of, well, I kind of would like this to be dealt with by a GP. I'd like to talk to a clinician about this. It's not urgent. It doesn't have to be today, but it also doesn't, I don't really want to leave it 6 weeks, but that's ultimately what's left is this 2 extremes of either that day or far in advance. We also have the impact on staff, which is obviously a huge thing for us as well, is this, there's a massive pressure on our patient services team at that 8 o'clock because just the volume of calls coming through, we obviously have all the call data. We can see how many people are calling through right when we open our doors to how many people are in the queue and how many people have called up so far through the day. And it's no surprise the fact that that is a really difficult thing for the patient services team to manage. There is also the fact that they are obviously trying to get everyone the care they need, but the reality is because of the system as it stands at the moment is a same-day system for the most part. As soon as they've used and reached that clinical capacity, it's also a very difficult thing trying to help signpost patients to the most appropriate care elsewhere. And a huge other issue, which this kind of funnel diagram is trying to demonstrate, is the inefficient use of capacity. So our appointments open up at the start of the day at 8 o'clock. We've obviously had the ones that were added 6 weeks ahead of time, which are booked out. We've had the follow-ups booked out, and whatever was left over is our same-day capacity. And then essentially when we reach that day, we all have all these requests funneling through, and they're all filtered based on time order, and they can only be filtered into that day of appointment. So essentially what you'll have routine issues that could wait perhaps a day or two, needing to go straight into that same day appointment and booking same day stuff, which means other same day queries that come through the pipeline may not have somewhere to go. We have requests that come through that are really important, that request essentially has continuity of care. So for instance, perhaps that you've seen the same GP for the last 3 appointments, you've already had this background conversation about your particular issue, it's an ongoing thing, but essentially when it comes to getting an appointment, all the appointments with that particular GP are gone because of just the way it flows into it. We also know that there are a large proportion of requests that come to the practice that actually we could resolve, we could help without an appointment. So there's a large majority of the requests actually that are booked into an appointment, or when you call through, you're told that you need to have an appointment for this, but you don't actually need an appointment. It could be resolved through a GP looking at it in a quicker amount of time, but yet that still takes up an appointment that then takes away from something else. So I would imagine that some of the things kind of touching on there probably hopefully relates to some of the experiences people have had, but there are many other issues that kind of come from this, but that's a bit of an overview of what the current picture is of our system at the moment. So obviously we've known that there are some issues around the system, so it's been quite a long project of us reviewing this. The NHS England have been quite keen for practices to introduce a digital front door for access, but I think it's really important to stress the fact that you can do it well and you can do it really bad. And a lot of practices that have just kind of enabled some sort of e-consult or digital consultation tool as a bit of a bolt-on where they open it up for half an hour, it doesn't really help the problem. For us, it was really important that we're looking at this as a complete picture to figure out, well, what is the approach that's going to really help us achieve the kind of aims that we have in mind. So what that's involved has been a heck of a lot of data collection around our call volume, not just in terms of total, but trying to filter that down to unique numbers. So we're getting a better idea of kind of the number of individual patients requesting an appointment. We have done some questions within our phone system about whether issues are new or ongoing to try and get a bit more context around what the demand actually is. We released a patient survey back in April of last year that was incredibly helpful in terms of providing us insight into, for instance, preferences around continuity, how soon after raising the request people would like their appointment to be, and a number of other things. We obviously have the information of how many people we have on the lines, which gives us the capacity of our ability to kind of process the requests coming in. We obviously have data that's been analysed around the number of appointments, the actual capacity, things like the potential capacity we have versus the actual capacity we see after we account for things like leave and absence and other variables that kind of crop up as you go through the year. And we've been looking at that for about 1.5 years now. We've also done a massive deep dive in terms of national data sets and other kind of research that's available to try and inform the different systems that we use going forward. We didn't want this to be something that we just rushed to, we quickly chucked out there, but then it suddenly disproportionately disadvantaged certain patient groups. It didn't actually help patients get better access. It didn't help staff from the backside of things, from a workload point of view. We didn't want to rush into something, so it's been a lot of looking at what else has been available to inform our kind of movement going forward. I've had a lot of conversations with other practices based on the models that they've had. We've done surveys to different practice managers as well to kind of see the full picture of whether or not they've introduced a particular tool like we're planning to. How has that gone? What impact has it had to make sure that the thing that we do again actually does have the outcome that we're striving for? We've also tried to get data on overall effectiveness and safety. And this is an interesting one when I say try to, because again, for context behind the scenes, again, NHS England has been very keen for GP practices across the country to have digital consultation tools in place. the thing that we need to bear in mind is that this isn't just a small change to general practice. It's quite a significant, substantial thing. So it's interesting that there isn't huge amounts of data about the effectiveness of does this actually help patients in the long term resolve their queries? How does it impact things like knock-on effect to hospital admissions and things like that over time as well? We've also modeled a heck of a lot of data against the different approaches in an attempt to try and gain better insight about what approach is going to be helpful to move towards. So all of that background work has gone into us essentially having this resulting new system that we're looking to introduce. And that system change has two main areas. It is firstly the structure and the format of our appointment diary itself, which is the behind the scenes setup of our clinic templates, how many appointments do we have, when are they releasing, at what points, and things of that nature. And the key focus around that side of things is the introduction of a better tiered system that allows for more routine capacity. We are very much wanting to move away from this day-to-day need and try to make sure that we're making use of the full entirety of our capacity, so that when the requests are coming in, let's say on a Tuesday afternoon or a Friday morning, that it's not just what's available at that point where the request is being raised for what's available, but you're looking ahead to try and make use of that capacity in a much more efficient way. So this evening, I'm not going to dive into the breakdown of the proportions, but the key thing there is the fact that we're trying to introduce just more routine capacity so that those issues that don't necessarily have to have an appointment today aren't left with the kind of need to just call back to access appointment that's available tomorrow. And actually, if it's something that's appropriate for an appointment, let's say in 2 days' time, that appointment is made available for that request. That's the purpose of changing the structure and format of the appointment diary. The main thing we're going to be talking about this evening is going to be how requests are submitted to us and how are they processed by the team here. So that's the thing that we're going to do a bit of a dive into. And perhaps the easiest way to do that is by showing you the system itself. So I'm going to pull over onto the screen here. I'm just going to get the thumbs up from colleague there. Brilliant. So hopefully what everyone can see on their screen here is essentially the welcome page, the home page for what the new system will look like. So just to be clear, the way that requests will be raised to the practice going forward, I'm going to quickly move this back to the side so we can have a little visual of this first. This is the bit of schematic overview. So the patient request will come in. Patients can essentially use the triage form directly by going through our website or soon to be the NHS app to access the portal that we're going to be looking at. But really, really importantly, because this is the biggest thing that comes up when you say that we're introducing a new online consultation tool or an online request form, is what about people who don't have access to that, or who aren't as digitally literate or have difficulties using this digital pathway? And the answer to that is it will not be just a digital form only. Patients will still be able to call up the practice and have the team take them through the portal that we're about to have. And also patients can still come into the practice to raise a medical request. What we will be having is two essentially tablets that will be in the reception area for patients to use themselves to submit medical requests at the practice. For instance, for those patients that may not have access to a laptop, a computer, or a smartphone that has access to the internet, but doesn't necessarily want to call and talk through their request with the team. So I want to stress at the offset that the tool we're going to be talking through can be accessed in multiple different ways. But essentially what will happen is when the patient raises the request through the various different means available, they will be introduced to the new triaging system, which is called Rapid Health. So Rapid Health is a tool that's basically enabling us as a practice to get better information about each individual request so that we can match it to where it needs to be better and to make use of our capacity much more effectively. So what we'll see in a moment when we start using the tool is that the two outcomes of the tool will either be a request will be automatically processed into an appointment, So what that means is that if, for instance, you're completing this form, you answer the series of questions prompted to you. If that request is appropriate for an appointment, you will be offered the ability to directly book into an appointment without the need to be raising it with a member of our team. So it's just trying to make sensible decisions that if something's really appropriate to be seen by us, that patients essentially are given that opportunity to book directly in. The other thing will be the requests coming into the inbox. So a big change is the fact that we will now have a triaging team. So whereas before requests come directly into the patient services team, now the requests will be managed by 2 clinicians, which is going to be 2 of our salary GPs. So they are part of the Moatfield team. We won't be having like additional outside locum support to do this triaging. They will be part of our internal team that exists already, as well as our patient services team, who will be looking at the inbox and seeing if there's anything that can be actioned without the need for an appointment. Let's say it's a fit note request, for instance, or perhaps a medication query that we can resolve without needing an appointment booked. They'll be looking at other things and booking appointments in. They perhaps will be signposting to other services as well where appropriate. For instance, if there's a minor injury request that's come through and we aren't able to deal with that suitably here, they can appropriately assess and triage and direct to the most appropriate place. So that's how requests will be raised. And as I said, that's how we'll access this portal that we're going to be going through now. So again, you'll be able to access this via our website by simply clicking on a link that will take you directly to this page. You don't need a login, you don't need an account to do so, you just need to click on the link. If you're calling through, the team will be using this same form behind the scenes, and if you come into the practice, this is the form that you'll be greeted with. So what we have here is essentially 4 different sections. The first 2 are regarding medical requests. The third is about questions and admin queries. And this is an important feature because, as I said before, there's quite a large number of requests that come into the practice that ultimately, at the moment in the current system, you need to book an appointment for that to be resolved. Well, actually, moving forward, if the GP who is triaging the inbox can look at that and say that can be actioned without an appointment, that is a very helpful thing for us to have available. And then finally, at the bottom, there's some self-help information based on the issue or the concern that you have. You can find out any information to assist you with that as well. So what we'll do is we will start going through one of these medical requests to give a bit of an indication and demonstration about how this tool will work. The thing for me that's really important to stress is this is going to be a big change in the way that we work, both internally for us, but also patients. And we really do acknowledge that. The forms we're going to go through will have more questions than that's normally asked. And the core purpose of that is to get that benefit that we're after of being better able to match the request to where we pop it in the appointment diary. If we're introducing more tiered appointments for different things, we need to be able to filter out the different types of requests to make use of that new tiered appointment system that comes in as well. So this is very much a necessity for us to have, but we are trying to make sure that the way that we introduce this is as fair and as considerate as possible so that we're not disadvantaging different groups or individuals registered with us. So let's make a start. So what will happen is, as I said, you'll go through the website. We'll say we've got an adult medical request. We'll simply click select there. The first thing patients will be greeted with is a series of signs of red flags, which is, of course, incredibly important to have to safety net right at the start of the request to make sure that we're not using valuable time completing the rest of the form for something that needs to go to any or 999 for those things. So again, patients are able to have a look through that to make sure that they don't have any of those before moving forward. So once we've confirmed that we have none of these, what patients will then have is this search bar. This is one of the reasons we have opted to go for Rapid Health as a product as opposed to other digital consultation tools. And that's because this search bar, essentially, patients can search for what their query is in their own words. I've got a couple of demos that I'll just show you for these 2, but you could search whatever you would like in your own words. Other tools and other products that exist they don't have that ability to pop it down in your own words. You're left having a look at some fairly rigid pathways and trying to figure out whether they match your issue or not. And it doesn't have that flexibility to account for all the differences in terms of how you may be feeling your issue is and how you might want to kind of search for that. So based on what you search, I'm going to start with a very easy one for the tool to do to start with, which is back pain. You will click the search bar, and I should say as well that if you misspell things in that search bar, it is also okay. Things don't need to be spelled correctly for it to be able to pick up and make sense of what the request is for. But nonetheless, we popped in what our issue is, which in this case is back pain. What will be essentially immediately presented to the patients is a series of pathways depending on what is the most appropriate thing. It won't just give one, it will give options so that people can feel like they're choosing the most appropriate one. Most importantly, though, is whichever one you pick, as you complete that pathway, if the tool feels like that isn't the most appropriate one, it will automatically switch. So there isn't this pressure to get the right pathway selected right at the start. But for the back pain, I can see that I've got the first one, which is stomach, side, or back pain, feeling sick, getting sick, diarrhea. The second one is muscle and or bone or joint problems. I'm going to say that feels more appropriate for the request I'm raising. So if I click on that, we can see that this pathway is suitable for back pain, sports injuries, aches or pain, strains, and a selection of other things. And I can see that mine feels more muscular in nature. So I would, if I felt like this was most appropriate, I can select that pathway. If, for instance, it's back pain, but actually I click on this and it's to do with the sides and backs and something a bit different, I could see what it's suitable and for what it isn't suitable for and pick based off of that. Now, really importantly, if I get rid of the back pain, I use my, I'm going to say just change in size of mole. I'm going to search that. You can see that there isn't something that perfectly matches that right away. It will give us some selected options here. So for instance, if I select skin issues, I can see that this one is fungal nail infection, bites with no rash, cysts, or moles. So for this one, I would use that pathway. But importantly, no matter what is searched and what pathways are given in the first instance, at the bottom, there is always the option of if you can't find what you're looking for, you can basically, the tool can take you through a general history pathway to make sure that essentially when someone is raising a request, they aren't locked into very binary, very rigid different pathways. We have something that hopefully enables any request to be essentially triaged and put through to the practice. The one thing I will stress is the fact that if there is a pathway that's suitable, that is the best thing to use. The general pathway, because it is general in nature, will involve more questions. It'll ask for a lot more variety of different things. So if there's a pathway that's appropriate and meets the request that you're raising, it's always a better idea to kind of go with that to start with. So we'll use this example, seeing as I've got it searched in here. As I said before, this one says it's about moles, so I'm thinking that's appropriate for what we've got there. So I'm going to select that pathway. And at this point, what we're going to be wanting to do is to check that the person that's putting the request through to the practice is a patient who's registered with us. So what we'll be asking for is essentially key details around name, date of birth, postcode, email address, number. Once you've entered that information into the form, we'll click next, and it will just make sure that essentially the information there matches the information that we have on the system for you. So if on the previous form there we slightly misspelled the name, when we click next, it will say, can you double check to make sure you haven't got any sort of misspelling or just accidentally entered the incorrect date of birth or something like that. So next, we obviously just have a bit of information about how this tool is going to work. I'll be talking you through that, so we won't necessarily need to go through that right now. But then it's going to essentially start us off with the pathway that we selected. So with all of the different pathways and all the different forms that are available, all the questions are based on multiple choice selection options as opposed to free text. And that's really important because we're trying to make sure we get the most accurate information possible. And sometimes it's difficult to understand what applies to you or for people to describe what it is. So We'll go through a selection of these questions here. So, for instance, the one I said was about a mole that changed in size. So we're going to click on that one. Again, all the questions that we're going to be doing here will differ depending on the different requests we had. So, for instance, if we kept with that back pain request that we had before, the questions that you're going to be presented with will be different to the ones we've got here. But nonetheless, I'm just going to fill this out in a bit of a random way, just so we've got an idea of it. There we go. So once you've completed all the questions and gone through, and I believe for this one, this is the end of the pathway, so we'll see. There's going to be a series of different things that will come up. If, based on the pathway we've completed and all the answers we've given, we're saying that this is appropriate for an appointment with us, what we'll have is essentially appointments available to be booked. So essentially, if a request that a patient is raising with us gets filtered through the triage form and is deemed appropriate for an appointment, you will be offered an appointment to book directly into. So importantly, at the top, you can have preferences for the location. For us, we're a single site practice, so that wouldn't be something that we change. But we also have a person preference. This is a dummy platform, so it's not got our practitioners on there. But if I was to select there, I would have essentially the different practitioners. So for instance, if you've been talking to a particular GP here or clinician about your issue before, you can select the person that you have a preference to speak to, and it will tell you the availability that matches that. So for the appointments here, you've got the Wednesday appointments, Thursday and Friday. So really importantly, the appointments that are going to be shown or presented to you will be dependent on how urgent that request is. So if that request has been deemed urgent to be dealt with that same day, it will only show you appointments that are available that day. If there are no appointments free that day, you will be submitting the request to the practice so that the GP triage team can still look at it. If the query is more routine in nature, it won't matter that there are no appointments that day, because it will also be showing you what's available for the next coming day. In this instance, I know that it's going to be looking for the next 5 days ahead, and it so happens it's not going to include the weekend because obviously we don't have any appointments on the weekend. But let's say we did have one of our hub clinics on a Saturday running, we would have some appointments there that might be available on the Saturday as well. But really importantly, again, if the request is appropriate for an appointment, once you've completed it, the appointments will be there available to be booked. The ones that are telephone will be indicated by a little telephone signal. The ones without the telephone icon will just be left blank with the time there as well. So for instance, if I do that there, I can choose which location it will be at and then confirm my booking and pop that through. This confirmation message will then be emailed directly to you, just detailing when the appointment was scheduled for and the information regarding that. So that's if a request raised to us is appropriate for an appointment. If it isn't, or if certain pathways are completed, it will also have the ability to be sent straight to the inbox. So what I'll do now is just quickly move this back around here. And I'm just going to quickly skim through the screenshot slides as we've had the ability to go through the live version of that. So after that form has been completed, you will either be given that selection of appointments, as I said, or it will be directed to the smart inbox, which is really key because, again, the whole point of us having this new triage team is that we have clinicians who are now leading that triage pathway. So even if we don't have the clinical capacity at the practice to help with a particular request at that time, we know that we've got a GP who is looking at it to assess it and to assess the urgency of it as well, to really help make sure that that person who submitted the request to us is going to be directed to the most appropriate place, even if it isn't with us as well, so that patients feel safe and making sure that the signposting that we do is as effective as it possibly can be. Hopefully that's been helpful, kind of giving a bit of a demonstration of how that tool looks like. Again, the biggest thing I'm going to try and stress the most out of today is the fact that although this is a digital form, we are not going to make it so that you have to complete this form. If anyone has difficulties accessing this or completing it, you are able to still call the practice for our team to take you through that request, or to visit the practice and fill out that form as well. You are able to do the form on other people's behalf as well. As I mentioned at the start, there is the ability to submit medical requests for adults, but also for under 16s. Importantly, for the under 16 pathway, all those requests will come directly into the smart inbox, just because we want to make sure that we're getting a look at those rather than it getting put into an inappropriate place. So essentially the timeline for this is going to be aiming to launch the week commencing 10th of March. So the second week of March is when we're looking to go live with Rapid Health and our new appointment system. When we go live, we will obviously have more people on the site to help with any patients coming through. We'll have a dedicated phone line for you to call through if you've got any issues with that. We'll have additional locum cover to help bolster our capacity for the initial weeks as well, and we'll be popping on some additional drop-in sessions and support sessions so that everyone is able to raise any issues that they have or talk through with us at the practice. We do have this feedback channel on the website that's available now, so if you do have any comments or concerns that you want to raise directly to us, if you visit the web page above, if you just go onto Moatfield's website, at the front end it will have appointment information, then you'll just go onto the how to book an appointment. If you scroll right down to the bottom of that page, you'll find this feedback form. So if you've got any comments or feedback that you want to raise, you can do that. You can obviously still call and talk to the practice if you've got anything you'd like to do. But the other thing is just to keep in touch with updates that we'll be posting on the website as well as social media channels. We will have additional drop-in sessions as well. I do have some of those details actually. So the first drop-in session we have is the 20th of February from 1 o'clock to 4 o'clock. That will be at East Court. We'll be doing a post on social media just highlighting that detail. So that will be the 20th February, 1 till 4. And we'll do another one on the 24th of February, again, 1 till 4. For anyone that wants to come and talk to the member of the team and to kind of be shown through this in person as well. So that about concludes everything in terms of the demonstration. What I will do now is we'll move on to a bit of a Q&A session. So there is the Q&A function on Teams. Hopefully you can see the Q&A button there to access. And I'll just see if there's any questions. I don't believe any questions have come through so far. Yeah, fantastic. I think I've got 2 questions that have come in there so far. Oh, no, there we go. So just having a little scroll through, I want to get to the earliest one. Yes, so first question we've got, sorry, I was just scrolling through to get to the most recent one. We've got a question about the NHS app and having lasting power of attorney for a parent who doesn't have an email address. Yes, you can still, the NHS app access to this form isn't integrated yet. They are looking to get that done. Well, they're meant to get that done by the end of the first quarter. So hopefully by April, when we go live, it will be a feature. But if you're needing to raise a request, you can still call through or come to the practice to do that. Obviously, if you're doing it with her there and got the details, you can submit the request on their behalf as well. The NHS app portion will become available hopefully fairly soon at the start of this year. We've got another question about, will this presentation be recorded? Yes, absolutely, it's been recorded. We'll make sure we share it afterwards. Got a question about the breakdown of salaried GPs and part-time GPs. All of that information is available on our website, so have a look there. In terms of locum GPs, if the question is around that, locum GPs aren't a regular feature. We book locum GPs based on capacity needs as and when we have a lot of absence or annual leave that's booked in that we schedule. So we don't have any sort of routine scheduling for that. We've got another question here, is access to the form online available 24/7, or is it only available when the surgery is open? Now, this is a really good question to ask, and it's something that I'm going to be very open and honest with you about and say that there isn't a clear answer to this. One of the nuances to having an online consultation tool is the fact that we need to be able to safely process all the requests that come into the practice. So it's not just about the number of requests and number of appointments, but it's also just our ability to triage and work through all the varied requests. The goal for this sort of system is to have the access rolling the whole time, because the one thing we want to try and move away from is that massive peak and that need to get in at 8 o'clock in the morning. That is what we are desperate to move away from. So we are going to be paying very close attention to try and make sure that people don't have to get their request in right early doors straight at 8 o'clock. The thing that we have to bear in mind is that we will have a triaging team who will be going through a lot of different requests, and we want to make sure that we have enough time that we can get through all those requests, but also when they're getting through it, that they're getting through it safely, so that the requests aren't being rushed to get through more, and to make sure that the decision fatigue isn't setting in for those clinicians, so they're not making unsafe decisions. So we have looked at, based on our current demand profiles and how it'll look when we go live, and we hope that it will be open for the majority of the day. It won't be 24/7. It'll be very unlikely that it'll be 24/7, but it'll be for the vast majority of the day. The key thing is we don't want to close it off for people who have work commitments, and for instance, they're not able to get their request in until like 4 or 5, perhaps a little bit later than that as well. But it'll very much be a case of learning to see how this all unfolds for us as well. So in terms of that question, there is no hard answer for that, because the goal is to try and keep it open as much as possible and avoid this bottleneck, but we'll be just really careful in the way that we do this and look at it. So just going to scroll up a little bit there. Got a question: if my problem is not that urgent, will the system show appointment slots, say, later in the week, so that urgent problems can be kept free for those who need them? Yes, absolutely. That is a great question, and that is the whole point of this. So the way that the tool is working is, as we saw, you had a search bar where you type in what the request is or what your concern is. You're then going to complete a pathway which will have the set of questions. So when you're completing that pathway, what Rapid Health is doing is understanding how urgent is that issue. Is that something that we need to see today? We don't want to leave it till tomorrow. Is it something that needs to be dealt with urgently either today or tomorrow? Is it something that can be dealt with in the next 5 days? Or finally, is it something that could wait perhaps up to a month? And based on how urgent that query is and how it's been flagged, that's what will determine how far in advance the appointments are available. And it's very clever the way it's going to work, so that essentially on a rolling basis, the routine issues will never be taking up urgent slots. So there will always be that capacity for urgent problems. But it's trying to make use of the capacity going forward so that the routine queries still have something to go into as well. So the answer to the question is yes, absolutely. That's how it will work. Just going to scroll down. So I just have to refresh the Q&A session each time to get this. And we've got a question about, just going to scroll back, just trying to find where the last question was. We had quite a few one there. Got a question about how long will it take to receive a response via the triage. So the key thing here is that any medical request that's sent through this platform is by nature something that shouldn't be an emergency that needs to be dealt with by A&E or, for instance, calling 999. So when you complete this, Rapid Health will always be saying that you can expect a response within 48 hours. The key thing for us, though, and the reality is we'll be very much looking to resolve things on the same day that come in. So as soon as you complete that, you'll get confirmation that your request has gone into the triaging team, and they will be just receiving a response that same day, dependent on how urgent it is. Of course, if something is very urgent, we'll have the time, we'll basically be looking at that, so we'll likely be getting to that a lot quicker than anything else that comes through. Got another one that I see Emily's popped to answer to, so thank you for that. Will appointments still be offered at the minor injuries unit at Queen Vic? I've had an appointment there before. Yes, this is the reality of the system at the moment is we will be trying to make as best use of the capacity as we possibly can. And by using this in a conjunction with changing the way our appointment system is structured, it will be using things way better. We will still likely have a surplus demand for what we have capacity available for. So essentially directing to the minor injuries unit will still likely be a case for those things that are appropriate. Had another question about will 2 tablets be enough, and will privacy be provided? Absolutely. The placement of those tablets will be positioned so that you're not in the middle of that mainstream where you're coming down into the front desk so that anyone can see it. And that is importantly why we'll have those tablets as well. Because from a privacy point of view and a data protection point of view, we don't necessarily want all the patients to be being guided through this form by a person at the front desk in front of everyone else that's around. So absolutely attention will be given to making sure that when you're completing that, it's in a fairly private area so that people that are coming past won't be able to see what's going on. And in terms of having 2 tablets enough, based on the amount of footfall, we anticipate it should be okay. If we need more, we'll certainly get some, but we anticipate it should be enough. After launch, will there be a review period? Absolutely. We'll be reviewing this constantly because there's been so much work that's gone into the configuration behind the scenes of how different requests are processed in the destination for where they go. We're going to be looking very closely about how all that works, but just also chance for patients to feedback their experience as well. So we'll be having more sessions after these initial ones where we can kind of share the feedback that we've been collecting. The feedback form I mentioned a little bit earlier on is not just for now, but it's also just as time goes as well. So we'll likely be looking to have one a month after launch. Internally, we'll be reviewing it on a constant basis. Got a question here. Seems like the triage form will replace the telephone triage process. Why will this system work better with no increase in medical staffing at the practice? Yeah, great question. So that comes back to a bit of the visual I had earlier, and it's all about like what different requests are placed into the different appointments we have. At the moment, we have our patient services team who are obviously asking everyone what their issue is when they call through. Now, the reality is as they're not clinicians, they aren't skilled or they don't have the knowledge enough to be asking extended questions to clarify more details about the nature of the request to really determine whether this is something that needs to be dealt with today, 2 days' time, or can wait. That's not their place to be able to do so, and we need much better information to make use of that. So the reason why this will be better is because we're getting a much better picture of what that request is before making a decision about what to do with it. So it will be replacing that telephone triage process. And the very reason for that is because we'll have a better detailed answer and a better direction of where that request ought to go. So although we're not getting an increase in number of GPs and capacity, what we're using that for will be much better, which in turn will help to minimize the failure demand that we have. So this kind of ongoing turnover of requests where perhaps people aren't able to get through or have their request met with an appointment, and over time will help to essentially better match against demand coming through. Got a question about, can you explain the last selectable option on the advice or information? Absolutely. I can show you that if you'd like. I'll pop it up on here. Hopefully this is the section that you are asking about. So this is for self-help information, and this is just linked to the NHS websites. So if I go through here again, confirming that I have no red flag symptoms, what I can do is type in my query, like if I had back pain before. Based on what I've searched for, I can click there, open, and I'll be taken to the NHS website. So dependent on what you search for, in that search bar, it will be linked to just information that's available on the NHS website. So that would be what the last selectable option is regarding. Will patients be referred to 111 as they are now? Again, this ties into just how the process looks from processing all the different requests coming through. We hope that that will be reduced, but it is likely to still be a feature. It all depends on the capacity that's available, what the request is. But the point to really stress here is the fact that we would like to make sure that the things being referred to 111 are much, much more appropriate, but we'd like to think that basically the number of patients being directed to 111 will reduce because of how the new system will operate. If you're completing the form on behalf of someone else, I'm assuming you would need to put their details in. That's it. That's correct. If I do the form at 4 a.m., will it go into a queue or be sidelined? Any requests that will come through, depending on the times that we have the form open for, will come into the inbox. It won't be sidelined. It will go into the inbox to be reviewed by the triaging team that will be going through that inbox on that particular day. We've got, is this system used at other surgeries around England and Wales? If so, how are lessons being introduced into the Moatfield version? Yeah, I mean, this has been a huge part of it. Because the reality is there's not a great amount of data to really highlight this kind of approach to general practice on a wide scale. A lot of it is based on kind of just principles and trying to understand the data sets available to us, but we want to know how it's actually going to work in practice. So a huge part of this has been working with other different practices that have introduced similar things. What we've learned is from the practices that have introduced just a bolt-on tool, basically a pathway for patients to raise a request that without changing anything else about it, they can just now complete an online form. It goes to the practice. Essentially what that does is it doesn't help change the way that your appointments are booked. It's just created another stream of requests coming in, and it becomes incredibly difficult to manage all of that. And what you have is massive GP burnout and difficulty staying on top of it, because what you'll have with other practices that are of a similar size to us, you'll have a triaging GP who's essentially trying to go through 300 to 400 different medical requests in a given day, which is an incredible amount to process, especially if you're trying to remain safe and effective with what you're doing. I'm just going to see if we've got anything else. I know we've got some people popping their hands up. Unfortunately, the settings are such that audience members aren't able to speak through. So if you could pop any questions that you have into the chat. I'm going to do a very quick run through. I know we're running low on time here. I want to make sure I try and get to as many questions as possible. So I'm just going to do a very quick look. I've got a question about, can I ask for a blood test or other nurse activity? Yes, that is a fantastic question. Thank you very much for asking that, because I forgot to touch on it. This is obviously regarding medical requests. There is also a whole host of other things that will work just as they have done before. So whether it's around blood tests or booking in with nurse for wound care, things like that, a whole host of other things will work just as they ordinarily would. This is for individuals who are wanting to basically, you would be calling up the practice with the thought about potentially getting this issue, concern, or symptom addressed by a clinician at the team. That's what the new form will be for. I'm just going to keep scrolling through to see if I've missed any questions here. So 2 moments while I do so. To clarify, even when the NHS app is integrated, I can still access the form online without using it. Yes. Yeah. When the NHS app integration goes live, it just creates another place for everyone to access the form, but the web link will still be available. You can still do it directly from the website. Absolutely. I'm just going to see if I have missed any. I've got another question about what happens about phoning in for test results and further action if necessary. That will operate as before, so you can still call through to talk to a member of the team. As we're going to be having this kind of triaging team working alongside the patient services team, we're hoping that a lot of these other requests will be able to be processed in a much better fashion. The one thing I also didn't mention was that when you call up the practice, obviously the team are there to guide the patient through the form. But if we get the sense that this request is outside of the scope of what's appropriate for that form, or this person may have difficulties in doing so, perhaps English isn't their first language and all these questions are difficult to go through, the team still have the ability to put a free text request through to the inbox as well. So we're trying to make sure that essentially all requests and patients' needs are catered as best we can. But if you're calling up to find out about test results, you would still call through as you ordinarily would as well. I believe I'm going to see just quickly, I'm going to do a little bit of a refresh. Not a question, but a thank you for a very clear presentation. Hopefully others have felt the same as well. As I said, it will be recorded and we'll share it, and we'll have another one as well to do. Let me just quickly refresh. Can you submit a photo? That's a good question. We did so we've got our patient participation group at Moatfield, and we, before Christmas, had what we called PPG in the practice, or come and have your say sessions, where they were based just on the waiting room as you're going through to the back end of the practice for the blood test around the courtyard area. And they were there talking to a lot of patients. And this was one of the feedback that came up, is being able to submit photos straight through with the request as well. So the way that that would work is essentially for the different pathways where we have something like skin issues, where there's like a rash, where the triaging GP are going to really just want to be able to see it. We've directed those things to come straight to the inbox, and essentially what will happen as soon as the triaging GP sees the fact that that request is in regards to something they'll need a photo for, they'll essentially reach out for that as well. So you won't be putting the photo through with the request itself. It's just we know that that's going to be a much easier way to process it. So those things are kind of built into the way that we'll be processing things. Hope that makes sense. Got another one here. Really pleased Moatfield of being so proactive to try and reduce the frustration and improve the experience. I really do want to stress this. For me and for the practice, this is about trying to figure out what approach is going to be better for everyone and understanding the difficulties that patients have. It is a reality that we know about, and I personally have been very keen to try and address and change the system for a while now, and I'm very happy that we're at the point where we've got this new system that we believe is going to be very helpful. But just to stress, we are going to be learning a tremendous amount for this. And another reason why this change is helpful is it's giving us the platform to make future changes from. The old system was really rigid and inflexible, and it was really hard to make small tweaks to, whereas this new one will allow us to make more flexible changes on the fly, to just have a more constant improving system rather than just like one stationary thing that may have worked at one point in the time, but it's just stuck there and can't move forward. So that's another big reason for the change as well. I'm going to do the final little refresh there, and then we're going to round it up because I know that we're already a little bit over time and I don't want to keep you too much there. Will the triage team have access to your NHS records? Yeah, the triage team, as they're obviously GPs at the practice, will have all your medical records there as well. It'll be part of making sense of the request as well and seeing what's most appropriate. For instance, if they can see that your request has come through and you've seen, for instance, let's pick on one of our GPs randomly, let's say that you've spoke to Dr. Fielding the last couple of times and your request has come through and they can see that in your consultation histories, it makes sense to make sure that we're offering an appointment to you with Dr. Fielding rather than with a different GP, for instance. Another couple of thank you comments coming through. Very grateful for that. I know I said that was a final refresh. I'm just going to do it. I just want to make sure that if you've had a question, you've been able to ask it and it gets answered. So thank you very much for all the kind words that are coming through as well. I will say this has been a huge project. The amount of time that has gone into this has been significant, and the reason for that is because we have learned from other practices that if you just rush something like this, we've seen that their CQC inspection results come out as fairly damning because you don't consider how this is going to impact different patient groups. I've had conversations with Healthwatch West Sussex, talking through our plans, as well as other independent organisations, kind of handing over the plans and saying, look, this is our plans. How is this going to impact things? Is there anything else we can do on top of this? We've had great comments coming back from that. it's just really important that whatever we do actually helps and that we can kind of move with that rather than just doing something that just ticks some sort of contractual box somewhere along the lines, but doesn't actually help you, doesn't help us, doesn't help anyone else, or something that we just feel like is important and just like push on everyone. Yeah, that's been a real key part of that, and that's why it's taken so much time to do. So I'm going to wrap up there. Thank you very much for everyone and for all your questions and your time. I really hope that's been useful. The meeting will be shared as well, so that other people who aren't able to attend tonight can have access to it. Again, we have got another one of these sessions booked later in February, so if you would like to join that one as well, please feel free to do so. The drop-in sessions, just to confirm, will be on the 20th and 24th of February between 1 till 4 at East Court in the council chambers. If you're just wanting to pop in and ask a couple of questions in person, you're more than welcome to do so. But apart from that, we will stop there and I will finish there. So yeah, thank you very much, everyone. I'm going to finish off the meeting, stop sharing and leave there.